Cervical cancer remains the second most prevalent cancer among women and still claiming thousands of lives in the country, with both the young and elderly women bearing the burden of the disease.
I also used to have vaginal discharge, and I used also to have painful sexual intercourse that made it so uncomfortable. I couldn't even contain it even for a minute.
Beleni nilikuwa nimeanza kubleed, lakini nikienda hosi nilikuwa naambiwa ati ni hormones zina change, ati mara ati ni menopause inakuja, sababu nilikuwa na bleed 2 weeks alafu inaisha, inakauka kabisa, nakaa 2 weeks again na bleed.
According to oncologist Dr. Catherine Nyongesa, there are clear symptoms that when seen, women should immediately see a doctor to diagnose their problem early enough.
Women present with bleeding, which is very common with other infections or even fibroids. Women with fibroids will come with abnormal bleeding. Another symptom is postcoital bleeding or spotting. You have some spots of blood after intercourse with your partner. You may have pain during intercourse. You will have a discharge, an abnormal vaginal discharge. Sometimes it's clear, non-foul smelling, but with the time, it can be foul smelling mixed with blood.
And considering that cervical cancer symptoms mimic other infections, many patient cases have been misdiagnosed severally, a situation that delays treatment.
I was always told that I had cervicitis. Another diagnosis, I can't remember so well, but it was just a series of wrong diagnoses, and I used a lot of antibiotics, but it didn't work out.
All these symptoms mimic or they are similar to infection symptoms. They are similar to just hormonal imbalance presentation in women. They are also similar to fibroids. So how do you confirm that this is cancer? By number one, your doctor having a very high index of suspicion, and if you are being treated for these other common ailments like infections and you are not getting well, you have to tell your doctor, kindly just check for me for cervical cancer.
However, with early and correct diagnosis, cervical cancer is treatable.
Declared cancer-free in October 29th, 2022. And I'm so happy and I thank God about everything.
Hiyo 2020 nilikuwa nimeenda kufanyiwa pap smear. Daktari akanitumia message akaniambia my pap smear iko normal. Sasa mpaka sasa sijasikia anything, sijakuwa na hizo bleeding, hata sijawahi ziona, na hakuna mahali nasikianga yani naumwa.
Doctors are still calling upon women to make it a routine for cancer screening so that if a cancer is detected, then early intervention is done.
70% of the women, by the time you hit age 35, 45, ensure you've had cervical cancer screening. This is a disease that will give you a period of about 10 years to 15 years before it manifests itself. So we have a very big opportunity in the 10 to 15 years to diagnose this cancer before even it forms a cancer stage and it can be treated and be cured.
To always make it a routine to go for cancer screening. Anything you feel so weird down there, don't take it for granted. Don't shy. Whether it is UTIs, whether it is anything that you feel so abnormal, just take it up. Go to the hospital, have that diagnosis, because if I didn't go for an early diagnosis, I think I would still even be bedridden or I could have died long ago. Yeah, so early diagnosis, just make it a routine. All women, just make it as a routine so that you go for early screening so that you can be helped.
And for parents with daughters, then you are advised to ensure that your daughter is given the HPV vaccine by the age of 15.
We are encouraging parents, if you have a girl child, ensure to have your child vaccinated, especially the girl child vaccinated by HPV vaccination by the age of 15.
Robbie Omondi, K24.